Are doctors and hospitals dropping off of the Medicare Advantage networks? Let's find out why. One of the biggest challenges as an insurance agent and in an agency is at the end of the year when clients that have Medicare Advantage plans come with us and they want us to review all the new plans. And not because the plans are hard to review, because they're really not. They're different from each other, but the basic components and the basic elements are the same. But the biggest challenge that there is checking all their doctors and checking all the hospitals that the people go to. Because doctors and hospitals come in and out of the networks for Medicare Advantage plans all the time. And not necessarily only at the end of the year, but it happens also throughout the year. So you can select a doctor or a hospital that you like, and then at the end of the day, when you try to use it, you may find out that that doctor or that hospital is no longer in the network. And now you're either not going to be able to go to the doctor or the hospital, or if you have a PPO and the doctor or the hospital is out of network, you will pay a much, much higher copay for any services that are rendered to you. And here is the most frustrating part as an agent. I can look for all those doctors, all those hospitals, and everything that I need to look for you. And we do every single time. But if we do that during the AEP, which is the October 15th through December 7th period, and then here comes the OEP January 1st through March 31st, and all of a sudden your doctor changes or the hospital changes or the doctor decides that they don't want to be in the network of the plan that you're in anymore, or the hospital does the same thing. And once that March 31st deadline has expired, which is the last time that you have to make any changes, it doesn't matter if your doctor left, it doesn't matter if your hospital is no longer in the network, you will not be able to change the plan. And it does happen. It's very frustrating as an agent that we go through the trouble of finding the networks, finding the doctors for the hospitals, the doctors, the hospitals, and everything else that you want or that you need. And then all of a sudden, the doctor exits that network or the hospital exits that network. And then you find out that you can't go to that doctor or to that hospital anymore. And there's nothing that I can do or that any agent can do once that happens, once the final period, the OEP, is over after March 31st. It doesn't matter if your doctor left the network or if your hospital left the network, you will not be able to change the plan till the next AEP for the following year after that. There's no way, there's no ifs or buts. You can call Medicare, you can call the insurance company, and they will not let you get out of that plan till the next annual enrollment period. So if we put you, I want to make sure you understand, if you go into a Medicare Advantage plan and there's any changes on the network or the plan or anything that happens during the year after the OEP, you will not be able to change anything on the plan till the next annual enrollment period. So it's very possible that we look at everything and everything looks okay, and then all of a sudden there is a change and you're going to have to live with that change till the following annual enrollment period. Now, if you had a Medicare supplement plan, it wouldn't matter. It wouldn't make any difference whatsoever. Because in a Medicare supplement plan, there are no networks. The doctors do not have to be part of a network in order to see you. Same thing with the hospitals. The hospitals are not in network with a Medicare supplement plan. With a Medicare supplement plan, as long as you go to a doctor or a hospital that accepts Medicare, which is probably 100% of the hospitals and 95% or higher of the doctors, you never have to worry about networks because there is no such thing. There is no networks with Medicare supplement plans. Now, why do doctors and hospitals get out of networks? Well, I mean, it happens for a variety of reasons. Sometimes doctors and insurance companies have an issue. They may have an issue with billing. They may have an issue with pre-authorizations. The doctor may get upset with the insurance company because they didn't pay a bill on time, they didn't pay him, or it took too long for giving a pre-authorization. A hospital may have the same issue. They're not paying the bills on time, the insurance company. The hospital is submitting bills and they're being denied for whatever reason. It doesn't matter. At the end of the day, hospitals and doctors come in and out of network all the time. And sometimes it's the doctors that get upset with the insurance companies and they exit the network, or it's hospitals that get upset with insurance companies and they exit the networks. And sometimes it's all the way around. Sometimes an insurance company may not be happy with a doctor because they had very bad reviews from a patient and they will cancel their contract. So at the end of the day, it doesn't matter the reason why they're out of the network. If they're out of the network, you cannot see them. And if you do see them, you're going to pay a much higher charge to see your doctor or your hospital if they're outside of your network. Now, I'm going to read you a couple of more expenses that would make a huge difference whether you're in network or out of network, and that's why it's so important that you check. For example, if you are in network, this is for out of hospital observation services, you would pay $300 per stay after your planned deductible. If you're out of network, you will be paying 50% per stay after your planned deductible. So it's an insane amount of money. Outpatient hospital, same thing, $325 after your planned deductible. And if the hospital is not in network for that outpatient service, you're going to pay 50% of the cost of the services. Same thing with ambulatory surgical centers. If they're in the network on this particular plan, you're going to pay $275. If they're out of the network, you're going to pay 50% of whatever they did to you. PCP charges, primary care physician charge. If you're in the network, you pay nothing. If you're outside of the network, you're going to be paying 50% after the plan deductible. Specialist, same thing, $35. But if you're out of the network, you're going to be spending 50% after your plan deductible. And so on and so forth. I'm not going to go over the entire summary of benefits because you're going to find out that a lot of the services are going to be the same. You're going to pay less if you're in network, and you're going to pay a ridiculous amount of money if you are out of network, because the insurance companies are trying to control the expenses. They're trying to control the costs, so they hire doctors that are in the network because they're willing to take a little less money than other doctors. So if you go to the doctors that agree to take the plan terms and conditions with the insurance company, you're going to pay less. If the doctor did not agree to that, so you have to go to an out-of-network doctor, you're going to pay more because the doctor wants to pay more. The doctor didn't agree to take the small amount that the insurance company is willing to pay them. So it's really not the doctor's fault. The doctor is just looking for the best for his own pocket. And if you're in network, they're going to see you and they're going to charge you less. And if you're out of network, they may or may not see you, but if they do see you, there's one thing for sure you can bet on, and that is that they're going to charge you a lot more to see you if the doctor is not in the network of the insurance company that you have selected. At the end of the day, and just to close in this video, what you need to take out of this video as a summary is the following. If you're choosing a Medicare program, whether it's a Medicare supplement plan or a Medicare Advantage plan, you have to understand how the plan works. On a Medicare supplement plan, it's very simple to understand how the plan works because you have a couple of 2-3 components. If you have a Plan G, you just have your annual deductible of the $240, and after that, you don't have to worry about networks, you don't have to worry about anything. If it's a Medicare approved expense, it will be paid between Medicare and your Medicare supplement company, whoever you select. You won't have to wait for pre-authorizations, you won't have to wait for pre-approvals. You just go, get done whatever you need to get done, and it will be paid between Medicare and the insurance company. You won't have to worry about checking networks or any of that nonsense. If you have a Medicare Advantage plan, you will have to worry about the networks. You need to make sure that your doctor and your hospital and everything else you're getting done is within the network. Otherwise, you're going to be paying a very large amount out of pocket. Very, very large amount out of pocket for any services that are provided to you. So at the end of the day, if you have an Advantage plan, check your network, check your doctors, and check the charges you're going to be paying. If you have a Medicare supplement plan, you don't have to worry about any of that. You don't have to worry about the network, you don't have to worry about the doctors, you don't have to worry about anything other than making your premium payment every month. Now, the premium payments for Medicare supplement plans are really not that big, of a deal, especially if you select a Plan N. Typical payment for a Plan N for somebody 65 to 70 years old is anywhere between $80 a month all the way up to $150 a month. But I can promise you that it's going to be a lot less for you to have a Medicare supplement plan. Even if you pay a monthly premium, it will be a lot less than having a free Medicare Advantage plan that you don't pay premiums. But if you get sick, or if you have any kind of issues, if you need a surgery, if you need a procedure like an MRI or a CAT scan or whatever you need, it's going to end costing you a lot more. And it's going to be a lot more than you would have paid on a monthly premium for your Medicare supplement plan. Except now, if you have an Advantage plan, not only are you going to have to worry about paying all those charges, but you're also going to have to worry about the networks, which are extremely annoying and extremely difficult to maintain for the insurance companies, for the doctors, and for the consumer. If you have any questions about this video, or specifically questions about networks, Medicare supplements, or Medicare Advantage plans, give me a call. I will be glad to answer any questions that you have. And if you enjoy the contents of the video, give me a thumbs up and subscribe. In that way, and ring the little bell. And that way, every time that we post a new video, and normally we do 1 to 2 videos a week, you will be notified. As usual, have a great day.